Hello everyone and welcome to Healthline 3. For the next 30 minutes we will be diving in and discussing a common health issue, back pain. Joining me for this show is Dr. Matthew Hefner. He is a neurosurgeon with Willis Knighton Precision Surgery. So welcome Dr. Hefner. All right, so let's go ahead and talk first about back and we're going to talk about neck pain too. Many of us feel like we live with them constantly. What are some of the more common issues? And will we all experience neck and back pain at some point in our lives?
Yeah, great question, because the truth is that over 90% of Americans at some point are going to be experiencing some issue with neck or back pain. Common things are pain that starts in the middle of the neck, maybe in the muscles on the side. Same for the back. It's going to be right in the middle, maybe in the muscles just off to the side. And occasionally it will radiate or move down into the arms and legs as well. The truth though is that most of the time this can be treated with very simple measures. Okay,
so let's talk about those simple measures. What are some things, besides having your spouse rub your back?
Yeah.
What are some other things you can do?
Yeah, so really a lot of times people will have neck or back issues that flare up just because maybe the muscles that attach to the spine have become weakened over time. So a big core component of treating this is going to be getting involved with some type of therapy, physical therapy, or even a physician-guided home exercise program to strengthen those muscles to help decrease abnormal motion and to try to help with the neck and back pain. Other than that, over-the-counter medications, common anti-inflammatories, Tylenol, or prescription medications tend to help as well.
Often when we get stressed and anxious, it seems like we have more neck and back pain. Are those things actually associated? Do our muscles tense up and misbehave when we've got a lot of anxiety going on?
For sure. I see that all the time. People will come in saying, I was doing great, and then all of a sudden for the past few weeks, my neck has been tensed up, my back has been, and I ask, is there anything going on differently? Have you started a new job? Have you started exercising? Are you stressed out? And a lot of times it is. The muscles will tense up and will certainly flare up these issues.
So often our pain can be caused by overexertion. You get the weekend warrior, right? You decide to get out there and clean out your gutters or do things that normally you don't do. What kinds of advice and guidance can you give us to help prevent really the more serious problems that can come with lifting things that are too heavy or doing projects that really we haven't been doing anything like that before?
So a lot of it just boils down to what I tell people, common sense. So if it feels too heavy, if it feels like it's more than you can safely lift on your own, you need to go ask somebody to help you. Otherwise, if it's minor chores, minor tasks that don't involve heavy lifting, you want to use good posture, good form. So like we've always heard, if you're going to pick something up off the ground, make sure you bend down with your knees, keep it close to your body, and pull up just like that. Don't be hunching forward.
So that was a really great tip. Do you have any additional tips like that? I just say, honey, will you come help? But a lot of us want to try to do things ourselves. It makes us feel like we're still physically able.
Yeah, so if you're lifting anything very heavy, like I said, need to make sure you have somebody help you out. And otherwise, make sure you're not straining your neck looking forward. Make sure you're not straining your back. Keep your back nice and arched and tight. And I tell people too, if you know you have a big project coming up and you've had maybe some back aches before, always getting a back support belt's never a bad idea too.
So tell me about a back support. Is that just kind of like the belt that you see people wearing like at Home Depot who bring things down from the higher shelves? Is that what you mean by a back support belt?
Exactly. Nothing complicated, nothing like a prescription brace. I don't recommend those routinely, but if you're going to be involved with something heavy, it's just a simple Velcro brace you can pick up from any drugstore or major store around the area.
Are there any other things like that you recommend that people get as preventive for creating problems?
So nothing, specifically otherwise for preventative measures, other than just, being careful the way you're lifting things. And I tell them, if you do something though, and you feel like afterwards you've really pulled something out, like your back's bothering you, your neck's bothering you, visit your primary care doctor, let them take a look at you. Maybe they can put you on a short course of medications to help with the pain, stretches, things of that sort.
All right, well, we already have a caller. And Betty, please, welcome to the show and ask the doctor your question.
Yes, I have severe neck, severe extreme back, and my left hip is always locking up or feel like it's going out. I need to know what kind of help can I get? Where can I get it? I'm just like severe pain all the time. I can't even go to my mailbox or take out my trash or anything. I need help.
Okay, and so your question basically is you're in a lot of pain, you can't get to your mailbox, you can't get around and do much at all. What should you do? And I think the doctor's going to have a good answer for that one.
How long has this been going on for?
I really wish he would.
Yes. How long has it been going on?
Oh, it's been going on a long time, over 10 years. I've been out of work now for at least 2 or 3 years now. Not able to work or anything.
Do you live alone?
Yes.
You do. Okay, so that's especially difficult. Any advice?
Yeah, absolutely. This is something I see all the time. If this has been going on for a long time, and by a long time I mean, certainly over a few months, a good first step for anybody that's experiencing difficulty getting around, moving around, is going to be to consider getting involved with physical therapy. And that's something that certainly someone like I could set up, your primary care physician could set up, as well as getting you started on some basic medications, that not pain pills, not anything that's addictive, but things that are meant to help with the pain. That is a great starting point, and then we can reassess you after a couple of months of intense physical therapy and see how things are going from there.
Okay, as far as okay, so my primary care, I'm in the process of getting to pain management and going for some x-rays and things like that, but the pain is so severe and this process taking so long to, get these things done to get some help.
Yes, ma'am. If you're having any difficulty with your primary care physician, again, I'm more than happy to see you as well. I see a lot of patients that are referred to me, but I'm more than happy to see you as well. If you want to come to me directly, let me evaluate you, and we can always go from there.
Okay, thank you so much.
Thank you.
All right, thank you for calling, Betty. And, when you get to the topic of pain, talk about some of the things, we've all watched the opioid crisis, and we all have this fear of pain meds, which we now today know can be very addictive and have serious long-term consequences. And then we're all familiar with Advil, right?
Mm-hmm, yeah.
What's between opioids and Advil? There are certain things that out there that can help with pain that don't necessarily put you at risk of addiction.
Correct.
I would assume. Yes.
Correct. So things, I agree with you completely. Overuse of medications, pain medications specifically, have been a real issue in our society. And certainly there are patients that have severe chronic pain, and pain medication does have a very small role in that small fraction of patients. Other things, just than over-the-counter Advil, ibuprofen, is going to be things that work along the same lines. They're anti-inflammatory medications that cut back on that process going on, and they are prescriptions. So common ones I prescribe, meloxicam, Mobic, things of that sort can help out. And another big one that I prescribe too are muscle relaxants as well. They typically are not addictive, they're non-sedating for most people. These two types of medications are generally the ones that are going to help the most with most of the back and neck pain that I see.
All right, so I believe we have another caller. Let's see, is it Linda?
Yes.
Okay, Linda, thanks for calling. What's your question for Dr. Hefner?
Yes, I suffer from a lot of pain in my shoulder, and it comes from my neck, and it's like a stiffness, a stiffness in pulling and drawing, and my blood pressure stays up, because of the pain, you know. And I told my doctor I wanted an MRI because you know, referred me to someone to get an MRI because and I had got it done, and it, you know, it's you can't sleep, you know, unless you take something, you know, to make you. And I don't like taking stuff to make me sleep. And I don't like taking a whole lot of pain medicine. You know, but I have to take it to get some relief, you know.
Yeah, I think she really touched on the concern that I raised with the question just now about people are afraid of taking a lot of pain medicine. What do you have to tell her about it? It sounds like you've really got a lot of pain and you're not going to be seeing the doctor right away. I mean, there are things that should be able to happen right now to at least give you some relief.
Oh, absolutely. You know, I'm right there with you. Pain medication is not something that I typically prescribe unless it's somebody I've done surgery on. You know, I would recommend coming in to see me. Let me take a look at your imaging that you've already had, especially if a large component of the pain is pain that runs from your neck down into your arms or hands. That is something that may indicate more of an issue with a pinched nerve, a disc herniation. And so there are certain medications like gabapentin, Lyrica, very common medications that are meant to help more with the nerve type pain. And even medications aside, you know, there are things like injections that I can refer for to have done into the neck that provide very good long-term benefit, but always best, you know, for someone like me to evaluate your imaging first before we go down that hole.
Yeah, that makes good sense. All right, do you have any more questions for the doctor?
So in other words, I don't have to have a referral. I can I just make an appointment to see the doctor, or do I have to have a referral?
You do not have to have a referral, actually. You can just call my office and we will gladly work you in as soon as we can.
And where's the office?
Yes, where's your office? Where are you located? Of course,
we're
the Arklatex, so we always like to be specific.
My office is located on the Willis Knighton Bossier campus. So the Willis Knighton on Bossier has a few different buildings. We are in the Pavilion building on the second floor.
So it's right off 220.
Yes,
so it's easy access from Texarkana, Shreveport, all around. It's
absolutely
easy to get there.
Yeah, I have a lot of patients from the whole region.
So you say it's not. It's over. It's not online. It's not online. Offline.
No, it's not on Line Avenue. It's over in Bossier City, off of 220, over the near which crossroads? Airline, Benton.
It's just north of Interstate 220, right between Airline and Benton Road.
Yeah.
Okay. All right.
Okay. Thank you so much.
All right. Sounds good. Thank you so much for calling. So let's talk about, you know, these callers that we've had. What are some signs that somebody really does need to come see you? That this is beyond the, you know, take Advil every few hours type of thing.
Things that I see that, you know, I tell patients that they need to come see me right away, or the primary physician would, is pain, numbness, tingling that runs down into the arms and hands, down into the leg, commonly known as sciatica. That in itself is not an urgent issue, but if that's been going on for a long time, it's probably best to get in and see a specialist. Other things that are worrisome for me is if someone has neck and arm issues, but they're also developing weakness with the hands, clumsiness, they're dropping things, balance issues, and certainly any loss of bowel or bladder control is a very urgent issue that prompts being seen by me sooner than later.
All right, so next we have Catherine, is that correct? Is that our caller? What's we have another caller?
That's correct.
Okay, please go ahead
Hello.
and ask your question. You have a question for us? Okay.
You mentioned that this began in the neck and it goes down to the arms, okay?
It certainly can. Yes, that's one of the things that he was saying is when it begins in the neck and is shooting into the arms and you have a tingling or a numbness or something like that, that condition is one that merits calling right away and getting in. Are you suffering from that?
Yes, I am, but okay, like it started out in my lower back. I thought that it was, doing that. So
I think one of the things that's interesting that you've pointed out is that a neck problem doesn't necessarily mean you've got pain in the neck. It creates because of the spine. It creates problems in other parts of the body where you think, oh wow, I've got an arm problem or a leg or a foot, and actually you have a neck problem.
That's correct, yeah. And just because you have arm pain only and then no neck pain, like you said, does not rule out that it's not a neck issue. Anything that starts from behind the shoulder or in the arm and runs down the arm can indicate something like a pinched nerve from a bone spur, disc herniation. And like I said, if patients have severe compression from their neck, it can show up as balance issues, loss of bowel or bladder control, weakness on one side of the body or the other.
When people have these, I think of bulging discs. Often people will say, I've got to go see a surgeon. I've got a worn disc or a bulging disc or something like that. Those issues are fairly hereditary too, aren't they?
So we don't have a clear, direct genetic link that we know about, but I will say I see all the time patients will say, well, my mom had it or my father had it and it runs in the family. And so even though we don't directly have proof that it runs in families, I definitely see it, at least in the office, people are saying all the time.
Do you tend to see it more with men or women, or especially I would think older people, because your disc wears down over time?
Yeah, that's right. Our discs are made of mostly water. And so over time as we age, the disc will dry out. And as it dries out, the disc can start to bulge, herniate backwards, rupture. And so naturally that's going to happen throughout a lifetime. So not necessarily a male or female preference, but certainly in the older population. And we see a lot of times it's people who have worked very manual, rigorous jobs, but I also see it a lot in people who have desk jobs and don't.
So you actually raised an important question that I have. We've got a lot of people coming in who have problems because they look at their phone and they're texting all the time, or they have, what is that? Is it forward neck, posture, where and we're working at desk, and we've got our hands and arms maybe at a place where over time it causes carpal tunnel. Are you seeing a lot of text neck and all that? And how do you prevent it? What do we do?
For text messaging, there's not a whole lot you can do, just because the inherent nature of being on your phone is that you're constantly looking down and typing. So other than just not being on your phone all the time or constantly looking down, there's not a lot you can do for that, but we're just in such a digital and technical age that I certainly see it a lot. Now, all the time I have patients that have neck issues, and I ask, what do you do for a living? And like you said, they'll say, well, I work at a computer all day. And my first question is, what's the position of your monitor?
Yeah.
So I advise them, good ergonomics. Make sure you have a good supportive chair with good lumbar support, arch support, and then you want to pull the monitor up to directly in front of your face, so that if you're typing for hours on end, you're not looking down, you're looking straight ahead. And if you do a lot of desk work, take breaks. A lot of people benefit from standing desk. Take a break every 30 minutes, stretch your neck, walk around. These type of things best prevent it.
All right, great information. And we have a caller right now, Herman.
Yes, ma'am.
Please go ahead and ask your question.
I had a back surgery back in 2019 because of my L5 and S1 disc was completely deteriorated, and they put a cage in me. And ever since then, I've had problems with my lower back and my neuropathy in my leg.
Is this similar to what you had before surgery, or does it feel different?
Before surgery, I went down to the ground and couldn't get back up. So that's what caused me to go get my back looked at. but it irritates me more now than it did then.
Have you had any imaging since your last surgery of your back?
No, I have not.
Okay. So, you
And
know, there again, it's hard to say. Go ahead.
I've developed neuropathy in my legs, and it constantly stings from my hip all the way down to my toes. They had me taking gabapentin 3 times a day, 900 milligrams.
Yeah, that's quite a bit.
Some
I would
days
say at this point, if you're having issues, it doesn't necessarily mean that anything's wrong with the original surgery. We see this is that sometimes when you have a fusion in the spine, you hear about this, that the levels above and below get additional stress put on them. So it could be that everything is okay. Maybe we just need to re-image and see what's going on. It could also be that perhaps a level above or below is getting affected. And so that again is something I'm more than happy to see you for and get worked up.
Okay. Would I need because my primary doctor has put in a referral for Good Shepherd in Longview, but I still have not received any phone calls from them or Dr. Oshner.
Okay, so why don't you give him your phone number, give everyone your phone number on the screen so that they know how to call you directly.
Sure. It's 318-212-7280 or willisknightonprecisionneuro.com. We'll get you to
All
us.
right, let me get a piece of paper real quick so I can write down that number.
All right.
Thank you.
We'll give it a couple of times here. Okay, so one question I had is neurosurgeon, neurologist. How are they different, and how do you know which one to go see?
Yeah, and I get that all the time. People ask, well, I thought you were a neurologist. And so the real difference is just that as a neurosurgeon, I primarily treat and work up conditions that are treated with surgery. And a neurologist will primarily treat and work up conditions that are treated more with medications. So a common example, things that that I would not see would be migraine disorders, headaches, fibromyalgia, multiple sclerosis. But you know, issues that do affect the brain and the spine too, that do require surgery, I see those. So that could include severe head injuries, brain tumors, bulging disc in the neck and back. Most of the time people with neck or back issues are going to come to me rather than to a neurologist, just because if anything down the road, if it were to require surgery, they would need to see me anyways.
All right, and are you ready for the phone number again, sir? Okay, well, why don't you go ahead and give them your phone number one more time so people know where to find you.
Sure, 318-212-7280.
All right, so let's talk about different types of surgeries. They have a neck issue, back issue, a lot of spinal, and we've talked about these discs. What are some of the different options with surgery that you do and that people can even select from if that's appropriate?
Yeah, so a lot of it just depends on, so assuming we've done all the conservative treatments and things aren't working, or we just know they need surgery, a lot of it depends on where is the compression coming from. A lot of it boils down to, say if a nerve is pinched or multiple nerves are getting pinched off. Most of the time for the neck, that's going to be from a disc herniation. So that's going to be from the front. So a very common procedure for spine surgeons to do is where we go actually from the front of the neck to reach the disc space, to remove it, and to get the compression off the nerves. There are also minimally invasive options from behind the neck where we make a small incision in the back of the neck to decompress the nerve. For the lower back and the mid back, same concepts apply there too. My concept in general is to try to be as minimally invasive as possible while getting the work done that needs to be done. I'm a big fan and proponent of minimally invasive spine surgery. It gets it done quicker and gets the patient better and home much faster as well.
Oh, and those are all words that everybody wants to hear. All right, I think we have another caller now. Noah.
Hello?
Okay, yes. Noah, please, we can barely hear you.
Yes, ma'am. Can you hear me now?
Yes.
So, a few days ago, me and my dad were in the backyard and we were playing football. And he accidentally hit me in my groin region, and it's swollen up quite large.
Okay. Your groin is?
Yes, the groin
Okay.
region.
Yeah, if it's, you may have just pulled something or injured something. If it's something in the groin, and it's not starting in the back or running forward, for that I would recommend reaching out to your primary care physician, let them take a look at. In that area, it could be a whole multitude of things going on.
Okay, all right. Well, thank you for calling. Years ago, I was in an amusement park with my children, and we were on one of those rides where you go up, and then it goes, choo, and I had whiplash. My neck threw back, and it hurt for a year or so, but it seemed to heal. Do a lot of things like that kind of often heal on their own?
Most things will. Usually by about a year to a year and a half, most of these issues it won't be perfect necessarily, but it'll get much better to where it's not a nuisance. And so that's why even patients that have a disc bulge, a disc herniation, and they come in to me first in a lot of pain, I tell you, down the road you might need surgery. My goal is to get you through this without needing it. So if we can do things in the meantime until we reach that year mark, like therapy, medications, injections, my hope is that by the year mark or so, you're going to be fine without needing surgery.
Yeah, that's such good advice. All right, well, we have another caller now. Karen, welcome to the show. Please ask your question.
Yes, I have severe scoliosis and have numbness, tingling down my left leg. Do you treat scoliosis, or is there anything I can do without having surgery?
Yeah, so for scoliosis specifically, if it requires, a lot of times these do require very large surgeries, and it just depends. If it's something that's very large and complicated, I may consult with a mentor on, may do the case together. But for scoliosis, kind of the same principles apply, especially if it's setting in later in life. Is this something that's been an issue your whole life or just recently?
I got diagnosed when I was 15, and I'm over 50 now, so it just keeps getting worse.
Got you. Yeah, I think, I work very closely with pain management colleagues, and so they are doctors who are highly specialized in treating pain, not just with medications, but also procedures. And so that can be injections, ablations, which is nerve burning. A lot of these play a good role also in treating this type of pain, but it requires a good workup too. Before I do anything like that, I like to see people in the office, get a full set of scoliosis x-rays, MRIs, and really see what's going on before making those types of recommendations.
Okay, and we can just call your office and make an appointment?
That's right.
That's it. And the phone number again is?
318-212-7280.
Thank you so much.
All right. Well, final question is, this is football time right now. We've got the Super Bowl coming up. I had football on my TV, unfortunately, at home last night. Concussions. How do you know when you've had a concussion that's bad enough it's time to come see you or another specialist?
So anything with loss of consciousness, I definitely recommend getting in and getting seen. If it's severe on the field, they're going to have trainers there, typically coaches that are trained to know when it's time to go to the hospital. The definition of a concussion is going to be some sort of head injury, head trauma that gives you maybe loss of consciousness, but typically not, but just a severe headache afterwards. People say, I feel like I was run over by a train. They're going to have headaches, they're going to feel real tired and groggy. I would say, even though you have these symptoms, if they're mild, if it's been lingering for more than a day or so, I would go in and get that checked out.
And if you have a concussion, you need to sit out the sport for a little while?
Correct. So I work very closely with a lot of the regional high school teams, and so we have a protocol in place with the State Athletic Association. So my general protocol is you should not return to play or practice until your concussion symptoms are fully resolved at rest. So if it's been a few days and you're just in school or at home, but you're still having bad headaches and feeling sick, then it's not time to go back yet.
All right. Any other sports that often pose a risk for this?
The most common sports I see, football obviously is number one. I see a lot of wrestlers also. They'll be wrestling, they'll take a good, hard throw on the mat and hit their head. Occasionally basketball and soccer.
Okay, well, that is the end. Thank you so much for joining us for Healthline 3 We hope you have a really good day, and we'll see you back here soon.
Thank you.